Joining us now, infectious diseases physician and medical director of special pathogens unit at the Boston University School of Medicine, Dr. Nahid Bhadelia. She's an NBC News and MSNBC medical contributor. Also with us, U.S. national editor at the Financial Times, Ed Luce. His new column is entitled "America is Losing the Stomach to Fight COVID-19."
Wow. Ed Luce, tell us about America losing that stomach.
Well, the metaphor that the president endorsed and others embraced at the beginning of this fight was of a war on the virus, and the president called himself a wartime president. But the relaxation that's happening now in places with quite sharply rising rates of hospitalization, like Texas and Arizona, the Carolinas, patchwork across America, is, I think, if you use the war metaphor, more like George Washington going on vacation after crossing the Delaware. This isn't being prosecuted like a war. I think the images of these teeming casinos in Las Vegas, where the punters, for the most part, are not wearing masks, is actually a better metaphor for how the federal government and some states are approaching this virus, which is kind of hoping for the jackpot, hoping it's going to go away at a time when 1,000 Americans are still dying every day. And if you listen to the scientists, of course, Dr. Fauci is no longer, not since April, but been appearing on the podium with the president, and the coronavirus task force is being wound down. But if you listen to the scientists, they say this is it's like inviting a second coronavirus peak. All the wrong signals are being sent from the center and by many of the states. And so we're probably going to get what we don't want, which is another wave in the fall.
Or sooner.
Dr. Bhadelia, the country has been focused on these protests and racial justice in this country for the last couple of weeks, but just in the last couple of days, you've heard Dr. Fauci and Dr. Birx both sort of raise their hands again after being quiet for a couple of weeks and saying, hey, we're still here. And although we've gotten the cases down and the hospitalizations down in New York, which was the epicenter and drew so much of the focus, rightly so, in the earliest weeks of this crisis is still with us, and it's in new places that we hadn't been focused on before. So from your viewpoint, where are we in this pandemic in the United States?
Willie, thanks again for having me. I agree with everything Ed said. The only thing I will say is that I don't think we've left the first wave. In most of the places that we're looking at now, this is the first wave. 21 states are seeing steady increases in their cases. 12 cases are steady increases in hospitalizations. You know, when you talk about Arizona, they're at 83% of their ICU capacity. What happens when there are no more beds? And Arizona is treating this still as not the fight that it is. They have about 60 contact tracers. That's less than 1% the capacity to trace everybody, all the new infections that are happening in the first 48 hours to stop those chains of transmission. They don't have the capacity to do that. Their test positivity numbers are slowly increasing again. They're 12.5 yesterday. And so I agree with this. I think, and it doesn't, to me, it tells me that we can't have it both ways. We can't have an open society and not do the hard work at the public health level, at the government level, and at the individual level to make sure that we prevent those new infections. And right now, that's not the tenor that's been set, and it's going to lead to more deaths and more infections.
So, Dr. Bhadelia, let me ask you about what we've seen in the streets over the past couple of weeks. As Willie said, it's been a righteous cause, not just for the life of George Floyd, but for a 400-year battle against systemic racism in the United States of America. And at the same time, we're in the middle of a pandemic. Pandemic doesn't care about politics. It doesn't care about social justice. It doesn't care about Donald Trump trying to bully him reality. It just kills people, and it kills black people disproportionately because of systemic racism, even when it comes to health care in America. But with all of that said, how concerned are you that what we've seen in these protests, these righteous protests over the past several weeks, that we're going to see a spike in coronavirus infections and deaths. And how concerned have you been watching the crowds across America?
Well, Joe, you're right. This is a righteous fight. And part of the reason is because it is not just for the 400 years or 450 years of this history. It is because even this virus is showing us the fault lines along which, African Americans are suffering in a greater way than most other segments of our population. But anytime you gather multiple people in a small space, crowded people in a small space, you're potentially putting people at risk to transmit this disease. And so there is a concern that there will be an increase in infections. The good news and the thing that's on the side of the protesters, this is outdoors, and in some cases, people have taken the personal responsibility of wearing a mask. My advice to protesters would be to continue to try to wear that mask, to keep that physical distance, and to make a personal assessment. Do you have vulnerable people at home? And if you do, what is your plan to quarantine from them so that if you have an exposure and if you get sick, you can get yourself tested and you can keep yourself away from those around you who might be vulnerable? That's the best advice that I can give, and to reduce activities that might, put the virus back into the environment, yelling, use other items to make noise. And again, I think the big thing is allowing states where these protests are happening to get testing ramped up more so people can get tested if they have been to an event.
Casey Hunt.
Yeah, Ed Luce, I have a question for you about, we mentioned at the beginning of the show how some of the other countries in the world are experiencing rates of decline that are better than what the U.S. Is seeing right now, that our numbers in terms of cases and control of this virus just don't stack up to places that, we would normally expect to be able to do better than. What's your view of kind of how this impacts, will Americans be able to travel overseas? Will other countries be worried about letting people in? I mean, what are the kind of global ramifications of the continuing failure on this front?
Well, America is, like the rest of the world, we're as strong as our weakest link. And so countries that are seen to be ineffectively or incompletely upholding discipline on the guidelines, the scientific guidelines, are going to be punished in terms of their travelers being allowed to visit. I mean, Greece is a very good example. To many people's surprise, Greece, unlike Spain and Italy, has had very, very low mortality, has adopted social distancing very early, and they're now opening up as a result because they took the right steps. But they've got a list of countries where they don't want people arriving unless they do a 14-day quarantine, which, of course, if you're going to be vacationing in Greece, is completely pointless. So I think that the United States and other countries like Britain is in a pretty similar position to the US, slightly worse in many respects, are going to find that their travelers, their tourism, their business travel will be inhibited by their country's poor track record of having serious contact and testing, contact tracing and testing systems in place. America is still very far behind where it could be.
Yes, it is. Ed Luce, thank you very, very much. We'll be reading your new column in the Financial Times. Dr. Nahid Bhadelia, thank you as well. Infectious diseases physician and associate professor at Boston University Medical School. Thank you. And
thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.